right, well, thank you everyone for joining us today for this Dementia-Friendly Communities webinar. I hope you all had a great long weekend and are coming back to the work week re-energized. My name's Laura Katawaki, and I'm a Research and Knowledge Mobilization Specialist with United Way BC, and I'm really happy to be hosting this webinar today on dementia-friendly communities. I'd like to do a land acknowledgement for the webinar. Today, I'm joining you from the traditional, ancestral, and unceded territories of the Musqueam, Tsleil-Waututh, and Squamish First Nations. I'm really honored to be on these territories and would like to thank the keepers of this land for all the work that they do. I'd encourage you, if you know the lands or territories that you're on, to share that in the chat. All right. I'd also like to just do some brief housekeeping notes before we begin the webinar. So during the webinar, you will be muted during the presentation. Feel free, though, if you'd like to introduce yourself in the chat box. You can put in, for example, your name, pronouns, organization, and territory that you're calling from. If you would like to use the closed captioning feature during the webinar, you can turn that on by pressing the CC button at the bottom, and then you'll get automatic closed captioning. There also will be a question period at the end of the webinar, so feel free to use the Q&A feature to put in questions, or you can also ask questions in the chat. And the webinar is being recorded and it'll be posted on our Healthy Aging Core websites. And after the webinar, we will send you a copy of the recording and the slides. All right, and then next slide. And so today our presenter is from the Alzheimer's Society of BC. So Lindsay Grasso is a support and education coordinator with the Alzheimer's Society of BC, and she brings her diverse experience to her role, having completed research on dementia care practices and working both within the community and long-term care sectors. She's passionate about supporting persons living with dementia and their care partners throughout the dementia journey. All right, and so then without further ado then, I will hand it over to Lindsay for her presentation on dementia-friendly communities.
Alrighty, thanks so much, Laura, and hello, everyone. So as just people, trickle in and get settled, we'd really appreciate it if you could just complete a short survey, just a few questions, just about your current understanding about dementia and just how to support people who are affected by dementia. You can use the QR code that's on the screen, but I've also popped the link in the chat box as well. So if you can just complete the first part, so questions 1 to 6, and then we're going to come back to the last part at the end of the presentation as well. Really, just as a non-for-profit, we're always striving to improve our programs and understand how we're making an impact in the community. So one of the ways that we can do that is just seeing if we're meeting our learning objectives. So it would be really helpful if you complete that for us. Okay. So as Laura mentioned, my name is Lindsay Grasso, and I'm a Sport and Education Coordinator with the Alzheimer's Society of BC. And welcome to our Dementia Friendly Communities workshop. This session is really intended to be a high-level overview of what dementia is and what we can do to make our communities more dementia friendly. And I do want this session to be a bit interactive. So there's going to be times where you can share your experiences and ideas and thoughts, and of course, ask questions. So if you can just, pop it into the chat box, I'll do my best to monitor it. And I know that Laura was going to be in the background as well to do so. Or if you really want to, I think you can use the raise hand function as well. I would like to recognize that there might be people here today that you have a personal connection to dementia, and maybe they've been recently diagnosed or providing care and support to somebody who is. Of course, this can be quite a sensitive and emotional topic, so I do ask everyone just to keep, your fellow participants in mind and use due consideration and respectful language when asking any questions or commenting. There also might be some deeper questions that come up for you after today's workshop. So, if you find that you need to talk about anything that we aren't able to cover here today after the session ends, please feel welcome to always give us a call on our First Link Dementia helpline. The number is at the bottom of the screen and also will be shared at the end as well. So, before we move into some of the topics we are going to be covering today, we are going to begin with a message from David. David is a lived experience partner with the Alzheimer's Society of BC, and he's going to be taking a few moments just to talk about the importance of becoming dementia educated and creating a more welcoming, inclusive, and supportive society for people who are affected by dementia.
Hello, and
Cool.
thank you for joining us today and taking the first step towards becoming a dementia-friendly society. My name is David, and I was diagnosed with Lewy body dementia about 5 years ago. I was a bit shocked at the diagnosis at the time, but I've definitely learned to live with it. I'm an avid golfer, although poor one, and I go to the gym regularly. I enjoy traveling. I love to stay involved in the community, Chilliwack, where I am now. I've been really fortunate to have the support and encouragement of my wonderful family and amazing friends. But many people who are living with dementia, however, report feeling alone and isolated in their community after a diagnosis. I certainly have had sessions where, I had that going through my mind too, but this isolation is heightened when people in their community assume that the person is no longer capable, or perhaps they're afraid of how they'll start behaving, or they're worried that they won't know what to say or how to respond if the person does need support. So, but a diagnosis of dementia does not mean the end of a meaningful life. People living with dementia want to continue to enjoy the activities that we all love, stay involved in our community, and to be seen as valuable and rightful members of society. Education, resources, and open conversations about dementia can help all the community members feel more confident in reaching out and supporting a person affected by dementia, both the people who are living with dementia and their helpful care partners. And this may help people with living with dementia to feel less embarrassed about the changes they're experiencing and reach out for the support that they need. So thank you again for taking the time to learn more about dementia and how you can better support people in your community that may be affected by dementia. You are taking a very important step in creating a more welcome, supportive, inclusive, and dementia-friendly society. Thanks for listening. Hello.
All right. So, David touched on some of the things that we're going to be talking about today, from what it means to be dementia educated to some of the societal barriers faced by people affected by dementia. And we're going to be focusing on four main key takeaways. So, the first is understanding what exactly the Dementia Friendly Communities Initiative is and why everyone has a role to play. We're going to spend some time discussing what dementia is and what dementia is not. So, recognizing some of the signs and symptoms of dementia, as well as go over some of the more common myths and misconceptions about dementia. We're going to be exploring some communication strategies together, which you can use to support your interactions with people who are living with dementia. And lastly, of course, we'll wrap up with discussing where you can go for some more information and resources and support. So, to start us off, I do want to take a moment just to introduce you to the Alzheimer's Society of BC and our role in the Dementia Friendly Communities Initiative. So, our vision at the Alzheimer's Society of BC is a world without dementia. But until that day comes, we're committed to building a world where people living with dementia, their care partners, and their families are acknowledged, included, and supported. And there are many ways that we're working towards our vision. So, our community service team works directly with people who are affected by dementia, whether they are living with a diagnosis themselves or supporting someone who is, to ensure that they have the support, information, resources that they need throughout the dementia journey. We also support dementia research initiatives, so working to mobilize that information to the broader community. And we're also at the forefront of public policy analysis and government relations so that we can ensure that people who are affected by dementia are aware of and have a voice in the societal issues that impact them. And all of this brings us to our Dementia Friendly Communities initiatives. So, which we at the Alzheimer's Society of BC work with municipalities, public sector organizations, and private enterprises to help them create their own dementia friendly plans, which can include the training of staff and volunteers, guidance on making physical spaces and policies more dementia friendly. So, there can be many ways that we can make our communities more dementia friendly. But before I get into a few, I would love to hear from you and just some thoughts and what you think makes a community dementia friendly or what being dementia friendly means to you. So I'll just wait a few moments and you can pop some of those ideas of yours into the chat box. In a couple more seconds. The support network. Absolutely, Harriet. Accessible services, yes. Resources readily available, non-judgmental, gentle people with patience. Yes. So absolutely, as just because some of those answers are trickling in, you've all kind of hit the nail on the head. So it's a community that's supportive, inclusive, and accessible for persons who are living with dementia and their care partners. So it's a community that focuses on stigma reduction and inclusion of people living with dementia. It's a place where people living with dementia feel supported by individuals, businesses, local governments, and are able to participate in their communities to the fullest extent possible. So, with these characteristics, this means that dementia friendly communities are defined by both their social characteristics. So, for example, having community members that are dementia educated and are able to recognize and communicate effectively with people who are living with dementia, as well as I saw your Eric, your note there about signage and wayfinding. Yeah, so there are physical characteristics as well. So the physical environment that supports the needs of people who are living with dementia. So one that's accessible, easy to navigate, such as having clear and legible signs that's placed at eye level, for example, around entrances, exits, washrooms, adequate lighting, and having well-kept and walkable streets and sidewalks. And to put some of these characteristics into practice, I am going to play another short video for you. And this is from Dementia Friendly Canada. And this illustrates some examples of what being dementia friendly in our communities can look like. Billy?
Did you know that more than 500,000 Canadians, like me, live with dementia? Or that 1 in 5 Canadians care for someone who lives with dementia? Like me, many people living with dementia still live in our communities after we are diagnosed. It isn't always easy, though. Often, we feel left out and worried about how we'll be treated by others. Sometimes people just don't understand what dementia is and how it affects the brain, or know what to do if we forget something or get confused. So they seem frustrated or dismissive, and sometimes the places we'd like to go are just more difficult to get around. I once got lost trying to find the washrooms in a restaurant because of the loud music, poor lighting, and confusing signs. But it doesn't have to be like this. Everyone in the community can play a part in helping people living with dementia feel welcome and in creating accessible and inclusive spaces for everybody to enjoy. When our communities are dementia-friendly, people living with dementia feel less worried about how we will be treated and more confident about going out. Have you ever thought about what it would be like to live with dementia in your community or workplace? Is your community supportive, inclusive, and accessible for people living with dementia? Is it dementia-friendly in ways that let people stay engaged in community life? Would you recognize the signs that someone may be living with dementia and be able to offer the right type of support? Would you be comfortable talking to someone if you knew they were living with dementia? Would you know how to respond if someone seemed confused or had trouble expressing themselves? Are the businesses, organizations, and public spaces in your community designed so people can use them independently without getting disoriented, lost, or experiencing stigma because they are living with dementia? People living with dementia shouldn't have to work harder than everyone else to stay a part of the community. Wouldn't it be great if the neighborhoods and communities that we all share were dementia-friendly? Together with the Alzheimer's Society and community members like you, let's keep challenging the stereotypes and building a dementia-friendly Canada where everyone feels welcomed and supported. Take the first step and visit alzheimer.ca/dementia-friendly Canada to learn more about Dementia-Friendly Canada. You'll find lots of information, education, and resources to help you and your organization become more dementia-friendly members of your community.
Okay. So what did you think about that video? Is there something that really jumped out at you or resonated with you? Um, as I'm waiting for a few responses to come in the chat box, the video mentioned that 500,000 Canadians are currently living with dementia. And as of 2022, we know that 85,000 people in BC are living with dementia. So if current trends continue, that number is expected to almost double by the year 2030 and triple by the year 2050. And really, we all have a role to play in creating a community that's understanding, accepting, and inclusive of people who are living with dementia. Check the chat box if there's anything coming up about the video. But really, yes, absolutely. We all have a part to play in making dementia friendly spaces. And really, one of the first steps in becoming dementia friendly is becoming dementia educated. So, knowing what exactly dementia is and some of the changes that a person living with dementia might be experiencing. Probably one of the number one questions that we get at the society is what is the difference between Alzheimer's disease and dementia? As these two terms are often used interchangeably. And dementia is the umbrella term for any disease that causes physical changes in the brain, while Alzheimer's disease is a type of dementia. So, to put into context, you can kind of think of the word dementia like you do the word fruit. Fruit is another umbrella term. You can have many different types of fruits, like apples and oranges and grapes. If I have a banana, I have a piece of fruit. But if I have a piece of fruit, it doesn't necessarily mean that I have a banana. So this is similar to dementia. If a person has dementia, it doesn't necessarily mean that they have Alzheimer's disease. They might have vascular dementia or frontal temporal disorders or Lewy body dementia that's causing their symptoms. Alzheimer's disease is thought to be one of the more common forms of dementia, and that's one reason why you hear the two terms often used interchangeably. It's also why our society name is the Alzheimer's Society. But know that we do support all forms of dementia, not just Alzheimer's disease. There are different subtypes of Alzheimer's disease, but they're all caused by amyloid beta and tau protein deposits, which causes plaques and tangles in the brain. So, to go through a little bit about the different types, there are four main groups of dementia, which are distinguished from one another by how the underlying disease impacts the brain. Dementia causes physical changes to the brain, and different types of dementias do cause different changes in the brain. So, there is vascular dementia, which is another common form of dementia, and it's typically caused by damage to blood vessels in the brain. Frontal temporal dementia, which is a group of rare dementias that primarily affect the frontal and temporal lobes of the brain and are primarily involved in the functioning of a person's personality and behavior. Lewy body dementia, which is a type of dementia that's associated with Lewy body deposits in the brain. And this typically affects areas of the brain that involve thinking and movement and can often be found with Parkinson's disease. Mixed dementia, so this is when the person has more than one disease causing dementia, like Alzheimer's disease and vascular dementia together. And then there simply can be the diagnosis of dementia or neurocognitive disorder, when there's no specific diagnosis made as to what disease is actually causing the dementia, but it's evident that a dementia is present. Now, even though there are many different types of diseases that cause dementia, know that each person with dementia is affected differently, but what they all have in common is dementia. And really, where things differ is in the beginning, where symptoms can be different since it depends on the areas of the brain that's affected. All dementias are also progressive or degenerative in nature, which means that the disease will advance and symptoms will get worse over time. How the disease progresses may look different from one type of dementia to another, and it can be quite individual as dementia affects each person differently. Something that we often like to say at the Society is that if you know one person with dementia, then you know one person with dementia. One of the key things about dementia that many people often don't realize is that it does cause physical changes to the brain, which can impact a person's behavior, personality, and judgment. And as you can see on the brain on the right hand side, there is significant shrinkage or atrophy that's been impacted by advanced Alzheimer's disease. These physiological changes causes damage to the brain that stores memories, retains new information, disrupts the physical senses, and ultimately causes damage in the brain's ability to process thought itself. Now, I recognize that this can be a really hard image to look at, and we don't show this slide to scare you or alarm you in any way, but we show it because it's important to recognize and acknowledge that there's a disease that's happening in the person's brain that's causing their symptoms. Unlike many other illnesses or disabilities, dementia often doesn't prompt, visual indicators that somebody is living with a serious health condition that's impacting their functioning. If someone needs the use of a wheelchair, for example, you have a very physical visual reminder that their abilities will be different than the abilities of someone with full mobility, and accommodations will need to be made. And people living with dementia have shared, how hard this can be with us, as some have actually come to dread the response of sharing their diagnosis and being met with, well, what do you mean you have dementia? You look fine. So, this image can really help us to work through some of that as serving as a little bit of a visual reminder that the person's brain is changing in size and weight and in volume, and that individuals with dementia are not in control of their symptoms, as the normal pathways of communication between brain cells have permanently changed. So, they are not doing the things that they're doing on purpose. So, in order for us to stay connected, really it's up to us to change and adapt. So, now that you have a little bit of an understanding of what dementia is, I do want to spend some time to discuss the more common myths and misconceptions about dementia, as many people have ideas and fears about dementia which just may or may not be true, and this can contribute to stigma and some fear of seeking support. So, the first is the belief that dementia is a natural part of aging. Research indicates that dementia is one of the top diseases people fear developing, and generally, this is because of a lack of understanding of dementia. Many people believe that dementia is to be expected in older age, and that everyone will end up developing dementia eventually if you live long enough. However, dementia is actually not a part of natural aging. While age does increase the risk for dementia, as it does a risk of developing, certain cancers, osteoporosis, arthritis, and so on, many people do live to be quite a healthy age with no signs of dementia. Genetics is also another question that comes up quite often around Alzheimer's disease. And for most people, Alzheimer's disease is not strictly genetic. Familial Alzheimer's disease does have a strong genetic link, but this accounts for less than 5% of all cases diagnosed. This gene does tend to cause young onset Alzheimer's, which is primarily diagnosed between the ages of 50 and 60, although it can be earlier. And sometimes people are concerned about having a family history of Alzheimer's disease, when in fact they actually may have a family history of other medical conditions that are risk factors for dementia. So, for example, like cardiovascular disease, diabetes, or hypertension. So, this is why reducing our risk for these diseases can also decrease our overall risk for developing dementia. But overall, the vast majority of people with Alzheimer's disease are diagnosed with what's called sporadic Alzheimer's disease, which means that there's no direct genetic link. Now, I mentioned a little bit about young onset, which impacts those under the age of 65. So, again, while age is our biggest risk factor, people in their 40s and 50s and even 20s and 30s can develop a form of dementia, including Alzheimer's disease, frontotemporal dementia, or vascular dementia. So the myth that dementia only affects seniors is untrue. And I know that there can be a lot of claims about how to prevent dementia. At this time, there's no proven prevention or cure for dementia. Currently, around the world, there are research studies looking into the causes of various types of dementia. But because their exact cause is still unknown, we don't know yet how to prevent it. Research does indicate that there are a number of risk factors other than age and genetics that could put people at higher risk for developing dementia. So, as mentioned a bit, diabetes, hypertension, obesity, poor nutrition, and smoking. But this is why we tend to speak about risk reduction as opposed to prevention. There is also a number of protective factors that can help to reduce the risk of developing dementia. And these can include things like physical activity, social activity, practicing good sleep hygiene, and protecting the head against trauma. Again, though, these factors are protective, not preventative. And you can always, start any of these suggestions, and this can help to reduce your risk. Um, I know that there's also a lot of claims out there around certain foods and supplements or natural health products that can help prevent dementia or reverse the damage that's caused by dementia. However, at this point, there's no conclusive evidence from research to support these claims. So as we age, many of us experience, some changes to our memory, like forgetting where we left our keys, forgetting where we parked the car, maybe not recalling the name of a colleague that we worked with some years ago. Having some changes to your memory doesn't necessarily mean that you have dementia. And these are all likely signs of natural age-related memory changes. And we'll talk about this a little bit more when we go through some of the signs and symptoms. But when it comes to dementia, memory changes are really only one part of the whole picture. There is also the narrative that people living with dementia will become violent or aggressive. While some people with dementia do react or respond to triggers in ways that may seem aggressive, it is important to acknowledge that not everyone with dementia becomes violent. It's important to remember that this behavior is often the result of a person either, having a difference in reality than us, or perhaps they're frustrated that they're having difficulty performing a familiar task or finding the right word, maybe not being able to verbally express themselves as they once did. So behavior can be a way of trying to communicate. And really, the more that we learn about the triggers of responsive or reactive behaviors and how we can adjust our own responses, the more likely interactions can be more positive in nature. If you do want to learn a bit more about this, as I know I went through it quite briefly, you can go look at our Understanding Behavior website, behavior webinar, pardon me, on our website, as it goes into a bit more detail. And as well as you can also give us a call on our First Link Dementia helpline. If there's something, that's coming up for you quite more and it's a specific situation, you can give us a call and we can help to kind of walk you through that a bit. Having dementia also, doesn't mean that the person can't understand what's going on around them. There are two language areas in the brain, one responsible for language in and the other responsible for language out. Not everyone with dementia experiences deficits in both areas, so they may be able to understand what's being said around them and about them, even though they might have difficulty performing or producing a response. This is also covered more in our understanding communication education, but really the main message is that it's important not to talk about the person with dementia in front of them as if they're not there. So trying to include them in conversations as much as possible. And we're going to talk about some strategies that you can use to help to support some of those interactions. And lastly, David talked about in his welcome video that dementia also doesn't mean the person will no longer have a meaningful life. A diagnosis of dementia doesn't change what makes each, person unique and invaluable individuals. The people, the things that we love, what motivates us, inspires us, and our values all remain. Over time, a person may have to adapt, how they do things, but many continue to be engaged in their favorite activities, connecting with people that they love, and contribute in meaningful ways to their families and communities. And this is something we can all help to support people who are affected by dementia to stay involved in their communities. And this can be a really huge part in making communities dementia friendly. So we talked a little bit about those myths and misconceptions of dementia, but I do want to spend some time talking about some of the signs and symptoms as well. And as we go through this list, I want you to keep in mind that, this is not meant to serve as a diagnostic tool. That is, experiencing these things doesn't necessarily mean somebody has dementia, but rather it's suggestive of somebody having problems with their brain. And if you or someone that you know is experiencing similar signs and symptoms, it can be related to dementia or perhaps other medical issues that may warrant a discussion with a doctor. So, to go through some of those common signs and symptoms, as mentioned before, it's normal to occasionally forget appointments, neighbors' names, or a friend's phone number, and remember them later. A person living with dementia may forget things more often and not remember them later, especially things that have happened a lot more recently. So, thinking about recent conversations or events, or difficulty performing familiar tasks. Being busy people, we can be distracted from time to time. And in thinking about hosting, a dinner party recently, we may make the sauce for the chicken and only remember to serve it halfway through the meal. The difference is that a person with dementia may have trouble with tasks that have been familiar to them all their lives, such as, preparing the meal or knowing how to make the sauce, which may have been something that they've, been doing for years. Um, a person with dementia may also experience communication challenges, and this can take many forms. So, for example, finding the right words. Everyone has that, tip of the tongue feeling, but a person living with dementia may forget simple words or start to substitute words, making their sentences difficult to understand. They may also have challenges following conversations. So from time to time, people can be distracted, lose their place of thought in a conversation. People living with dementia may actually have trouble following the conversation or be a step behind in the conversation. So thinking about, following along the plot to a TV show or a movie. And they may also have challenges understanding the meaning of what they're hearing or reading. A person living with dementia may also have difficulty with tasks that require abstract thinking. So this can include making sense of symbols and images. For example, images that appear on a sign. So thinking about the different road signs and understanding and working with numbers. They may also have difficulty understanding metaphors, so such as a place to hang your hat or it's raining cats and dogs, which may actually be understood by their literal meaning. So for example, thinking pets are, falling from the sky. And thinking about this, it can also be difficult to understand maybe some types of humor as well. Somebody might also have poor and decreased judgment. So, for example, they might wear heavy clothing on a hot day, or they may find it difficult to determine what to keep or what to throw out, resulting in their space becoming cluttered or, having expired food in the fridge. Disorientation of time and place. So, it's normal to forget the day of the week or your destination for a moment. But a person living with dementia can become lost in a familiar place or even within their own building or home, especially if there's, similar doors in those apartment buildings. Someone might knock on the door and it might be, mistaken for somebody else's home, for example. And a tip is to, encourage other residents, to be patient and maybe even suggesting that the person living with dementia put a familiar sign or object on their door to help with that wayfinding. Um, a person with dementia may also become disorientated to time and become confused about the season or year of or what era of their life that they're in. So, for example, being retired for some time, but thinking that they need to get up and get ready to go to work in the morning. Visuospatial, and perceptual changes. So while these types of changes are related, they're all distinct brain functions, and that can be impacted by dementia. So vision relates to our ability to physically see and take in that visual information through our eyes. And a person living with dementia may experience diminished peripheral vision, which can make it difficult, to track and gauge the speed of moving objects. They may also have trouble with depth perception and recognizing familiar objects or distinguishing between similar objects. A person might also have trouble initiating an activity, so meaning that they might find it difficult to get started and may appear to be stumped or, what that first step might be. And sometimes we can misinterpret this as the person being passive or apathetic. And we hear from people living with dementia that they feel that others see them as lazy. But sometimes a gentle cue or prompt may be really all that they need to start an activity. So, for example, somebody who absolutely loves doing puzzles and you're seeing that they're not doing them as much as they used to. Sometimes just having the puzzle, on the table with maybe a few pieces put together can be enough of a visual cue for the person to prompt them to do that activity. And lastly, physical changes. So, dementia can also impact a person's ability to move about their environment and manipulate objects. And in the early stages, you may notice changes with balance, coordination, and the ability to handle objects with their hands, as well as some changes in their gait. Okay, so I recognize that that was a lot of information to go through. And some of the signs and symptoms can be surprising to hear and can even bring up some emotions. So it really is worth reiterating again that this is not meant to serve as a diagnostic tool, but really just more of an exercise to help increase your awareness about some of the signs and symptoms and become more dementia educated, which we know is an important part of building a dementia friendly community. So, having that understanding of some of the common signs and symptoms of dementia and what somebody living with dementia may be experiencing, I do want to switch gears a little bit just to talk about the societal barriers of stigma and discrimination. This is one of the biggest challenges that we face when talking about supporting families affected by dementia, as even though 500,000 Canadians live with dementia, many feel excluded, ignored, and treated differently for something that's beyond their control. Stigma is defined as assumptions about a person based on their actions or appearance. And with a diagnosis of dementia in particular, knowing that it's something that impacts the brain, just hearing the word dementia can often come with assumptions and misconceptions about a person's abilities and capabilities. And with that, discrimination occurs when others act on those assumptions in a way that leads the person to being treated as incapable and feeling judged or deficient in some way. Stigma and discrimination can take many forms, and I do want to have a little bit of a discussion. So feel welcome to, pop things in the chat box. But, what are some things that come to mind when you think about stigma associated with dementia? Is there some aspects about stigma that you feel can be particularly challenging, not only for people who are living with dementia, but their care partners as well? The way as we wait for, just some things to come in the chat box. Um, you might be surprised to hear that, many people living with dementia experience stigma amongst professionals. And this includes, medical professionals, speaking to their care partner about them as if they aren't there, people minimizing symptoms because, they look okay. And thinking about this, what is somebody living with dementia really supposed to look like? Um, and this is something that's really comes up in one of the early stage support groups that I facilitate for those living within the early stages of dementia about, how frustrating and dismissive it is to have somebody say, oh, I just told you this, or don't worry, I forget things too. This can be really dismissive and leave the person feeling ignored, as we know that after going through some of those signs and symptoms, that somebody experiencing challenges because of dementia is different. And this is why, showing that picture of the two sides of the brain with somebody living with Alzheimer's disease versus a healthy brain can be so important to help us to remember that their brain is functioning differently. Check the chat box if anything's coming up for people just around some things that come up for them when they think about the stigma about dementia. Yeah. Thinking about, stigma too, there can be some self-stigma, which is absolutely experienced, and, feeling embarrassed or shame about changing abilities. And this can have a profound impact on a person's confidence and willing to stay engaged to their community, involved in their favorite activities, and stay in touch with the people that matter most in their lives. Thompson River held a destigmatization dementia and 6 people with lived experience. They encouraged us to not assume that they weren't capable, but give us examples that we should assume that they are. Yes, that's great, Paula. Thank you. And that's a really great way of, combating stigma as well. And one of the ways to become more dementia educated and understanding the experience of dementia is having conversations and raising awareness. It can be also by changing some of the language that we use. Language can play such an important role in creating a supportive and inclusive community. And you might have actually picked up on some of the language that I've been using. So, for example, saying people living with dementia, as its language that indicates that a person is more than their diagnosis and avoids assumptions about the person's abilities or experiences. This language is more inclusive than saying, for example, that the person is a dementia patient or that they suffer from dementia. While it is acceptable to say that one has dementia, it's not appropriate to say, for example, somebody is demented or senile. We also use the term people affected by dementia when we're referring to both people who are living with dementia and their care partners. We know that this is a disease that not only impacts the person diagnosed, but their whole families. And as a care partner has said so eloquently to us, he has the diagnosis, but we are living with the disease. So by saying people affected by dementia, it's more inclusive to this experience. And there's actually an excellent resource called Flipping the Stigma Toolkit, and it's at www.flippingstigma.com. And it goes into the different forms of stigma and some ways people living with dementia are combating it. So now you might be wondering, how can I help? What can I do to support somebody who is impacted by dementia? And you might interact with somebody living with dementia for many reasons, whether it's out in the community, in a professional capacity, or having a more personal connection, such as a family member or friend. So, ensuring that you know how to communicate appropriately and effectively can be so impactful in creating a society that's supportive and inclusive. So, we're going to go through some communication strategies together. And I do want to note that some of these strategies may not be relevant to your specific situation at this time, as they are more general and may become more relevant as things change and progress. But of course, you can always take and adapt these strategies to the situations that you find yourselves in. Also, as I go through them, you might feel, that these strategies are common sense or basic. But I'm not sure about you. And really, I can only speak for myself. But when I become frustrated, irritated, or stressed because of somebody else's behavior, my common sense out the window. So, really thinking about these strategies as a helpful reminder and general toolkit when interacting with somebody with dementia. And know that when times, communication appears to be breaking down, these just might be the strategies that can help us stay connected to one another. So, if you have the opportunity to do so, before your interaction, it can be helpful just to take a moment to consider some of the things that can help to set the stage. And one of the first things to do is to assess your own emotions. So, how are you feeling in that moment? Are you feeling calm and relaxed, or maybe a bit flustered? Maybe you're in a rush, or you can feel yourself getting frustrated. Our state of mind is often reflected in our body language, our tone of voice, and even in the pitch of our voice. So, being aware what our nonverbal cues may be saying about your emotions. Sometimes it's really not about what's being said, but how it's said. And this reminds me of a story a colleague shared with us about a friend of hers who I guess was telling her son that she wasn't mad at him. And her son responded with, "Okay, well, why don't you tell your face that?" Our tone of voice, our facial expressions, our posture, our gestures, all can show emotion. And even if, in that example, you're showing frustration or anger, and maybe our words aren't saying so, of course, somebody's going to be able to pick up on those emotions. So it can always be helpful to take a pause, take a bit of a breath, and regroup before engaging in communication. When taking this pause, this is not only a good opportunity to assess, our own emotions, but also the emotions of the person you're trying to communicate with and what they might be trying to convey to you through their body language. Do they look upset, anxious, frustrated, excited, scared? By focusing on their emotions, this can help you to understand their reality as well as guide how you might approach and respond to them. And sometimes coming into a situation with a calming presence, especially if the person appears upset or emotional, can really help to settle the person and open up some lines for communication. After you've taken a moment to set the stage, it's important to get the person's attention. And it can be helpful to approach from the front and maybe use touch when appropriate, maybe a tap on the shoulder, putting your hand on their arm as well. As we've talked about, a person living with dementia might experience changes in their visual and spatial awareness, and a loss of peripheral vision, as well as maybe up and down vision. So it really might only be what they're able to see is straight in front of them. So thinking about this, it can be quite startling if somebody, approaches from the side or from behind or starts speaking and you're not quite sure where that voice is coming from. So it can be helpful to make sure that you are in their line of sight. Something as well that I want to highlight and is important for setting the stage, especially if you know the person and you know that they use glasses or a hearing aid, seeing if they're wearing these items. If you notice that they aren't, maybe finding a gentle way to suggest that they put them on. So, for example, maybe you walk into your friend's apartment and you notice that their glasses are sitting on the table. After saying hello and maybe connecting with her for a bit, you can say something like, "Would you like me to get your glasses for you?" It might help to even show, where the glasses are or point to them to further augment your message. But really ensuring that that they have these items on can make a big difference in being able to communicate in a positive and effective way. It can also be helpful to make eye contact so that they know that you're talking to them, and by facing the person directly when speaking. So this might require you to position yourself so that you're within their line of sight. And if somebody is sitting, it can be helpful maybe to get down to their level, maybe by sitting or crouching in front of them. Now, eye contact, I will say, is something I recognize, not something everybody is comfortable with. For example, some cultures may interpret eye contact differently. So, coming back to the importance of nonverbal cues and body language, it can be a great time as well to assess, what their body language is telling you, especially if you're interacting with somebody that you don't know. So, do they seem anxious or scared? And then adjusting your approach accordingly. And this can mean being conscious of giving them enough space. Some people, feel a bit safer and less intimidated when given a little bit more distance and space in between. It's also important to ask if somebody, wants help. We can't assume that we know what's going on or what needs to be done. Sometimes giving people the time that they need to do things themselves is exactly the help that they need. So, being patient and available is really one of the best ways you can be supportive of somebody with dementia. If you notice that, somebody is really struggling to communicate with you and you see that there is maybe a lot going on around you, maybe there's a bunch of people walking around or a lot of noise around you, think about bringing the person into a quieter area or doing what you can to make the environment more calm. Sometimes having too much stimuli can be quite distracting and distressing for someone with dementia, as their brain is already working really hard to process what's going on. So, having fewer distractions can be soothing and can open up better lines for communication. Speaking clearly and sharing one message at a time. And it can be a bit awkward to slow your speech down in a way that, doesn't come across as speaking down to the person. Rather, it's more about making a conscious effort to speak slowly and focusing on taking the time to enunciate each word carefully and clearly. And coming back to the importance of language, ensuring not to use things like elder speak, such as honey or sweetheart. Although these terms are often, terms of endearment, when trying to connect with somebody, especially somebody that you don't know, it can come across as speaking down to the person. So, always ensuring to call the person by their name and speaking in a calm and respectful manner. It can also be helpful to share one message at a time. Sometimes we don't even notice that we're sharing, multiple ideas or instructions at one time, as our healthy brains can often deal with all of the information. So it is important to somebody with dementia. It might really only be that last part piece of information that sticks, or maybe it might become an all incomprehensible jumble. So, for example, if I were to say, okay, we're going to be taking a 10-minute break, you can go stretch your legs, you can check your phone, or you can go to the washroom. For someone with dementia, it really might only be the go to the washroom part that sticks. So, again, I really stress the importance of slowing things down and breaking things down into one message or instruction at a time. And when doing so, waiting for a cue from the person's body language. So thinking about eye contact, maybe a smile, a head nod, or even a response, just to see that they've understood you before carrying on to the next instruction or idea. So allowing time for a response. As a person living with dementia may need more time to process what you've said and time to formulate a response. It's actually been suggested to wait about 10 seconds for a response. Now, in theory, this sounds like a pretty simple thing to do. Waiting 10 seconds isn't too long. But when doing it, and I encourage you, to maybe go home and try this with some friends or family, a 10-second pause in the middle of a conversation can actually feel quite long and awkward, but it can provide the necessary space for a person living with dementia to be able to gather their thoughts and produce a response. Something that we get asked quite often is if the person is having difficulty responding and you know what they're trying to say, maybe the word, or you know the person well and you've heard this story before, if it's okay to jump in and provide that help. And it can be helpful to ask the person before if they would like some help. They may be relieved, to receive the help and know that you're understanding them. Or they might feel that they, want to spend some time to express themselves in their own way. And somebody shared with me that they've actually found it quite helpful to actually count to 5 in their head before jumping in and providing that support to the person. To further augment your message, it can be helpful to use actions, objects, or gestures, to accompany your words, as sometimes having both that visual and auditory information can help the person to understand. So, for example, if you are asking if they would like a cup of coffee, maybe pointing to their mug, bringing the coffee pot to them, or miming the act of drinking. You might also let them smell the coffee. A familiar aroma can be enough to help convey your intent. Really, the more senses that are involved, hearing, sight, smell, touch, the more information that they're able to receive. As the person might having difficulty using their words or verbally producing response, but they might be able to recognize the objects or the tasks if they see it. Can be also helpful to use close-ended questions. So, open-ended questions typically begin with words like what, where, why, how, when, tell me about or describe. These can be difficult to answer because these types of questions require the brain to first comprehend what you're asking, choose from a wide range of options, then formulate a response. So, if you're connecting with someone and you're seeing that they're having a hard time formulating a verbal response, it can be helpful to ask, close-ended questions, as they may be more successful as they often have that answer embedded in the question. So, for example, would you like a coffee or a tea? This is going to be a lot easier to answer than when going into a coffee shop and seeing over 50 things on the menu and going, okay, well, what would you like to drink? An even more straightforward approach, too, would just be to be asking yes or no questions. And it can always be helpful to rely on what you know about the person. So, for example, if you know that they prefer coffee over tea, asking things like, would you like a coffee, can prompt a yes or no answer to that question. When thinking about, asking questions, it can be helpful to think of them hierarchically. So, thinking about that illustration that's on the screen right now, the simplest questions to answer are yes or no questions, followed by questions with, limited answers, maybe two or three options. And then the most difficult questions to answer are open-ended questions. Now, if you notice that there's still some difficulty, it can also be helpful to repeat something in exactly the same way that you've said before. When something's rephrased too quickly, it can seem like a completely new question or instruction. However, though, if repeating is unsuccessful, rephrasing may also be a better option. And if you know yourself are having difficulty, understanding the person, you can also try repeating or rephrasing what the person has said to you back to them, and then asking if you've understood them correctly. And this can really help the person to further clarify what they're trying to tell you. Lastly, in conversation, you may hear things that don't make logical sense, or are not objectively true, or what they're asking for is not possible. So, for example, they want to see a relative that has passed away some time ago. Getting caught up in those details can be a big barrier in communication. And in these situations, it's helpful to not only listen, actively and carefully to what the person's trying to say, but trying to respond to what the emotional tone of the statement may be. You might not understand all of the words that are being said, but you might recognize the emotions, such as joy, excitement, sadness, or fear. The feelings behind what's being expressed are always right, even if what's being said makes no logical sense or isn't real from our point of view. So, really, the content of the communication doesn't matter so much as the feelings behind it. So, when you find yourself in a situation like this, you can start by acknowledging and validating their feelings rather than trying to respond to their requests or their stories in a logical way. So, for example, you can say something like, I see that you're really upset by this, or you seem really worried, or even, you seem really excited, but I'm having a hard time understanding. By taking a moment to acknowledge what the person might be feeling in the moment, you're then able to step into their reality, which can allow them to feel heard, understood, and reassures them that you're there for them. So, for example, let's say you made arrangements to drive a friend to their dentist appointment. When you arrive at their home at the time that you agreed on, just the day before, you find that, they're caught by surprise. They had no idea about the appointment. You can see that they look overwhelmed, maybe even a bit anxious. And they say that you didn't tell them anything about this appointment and now they don't want to go. In this example, it's better to apologize and acknowledge that they may be feeling frustrated, which is their reality, rather than launching into, something to convince them that you've spoken to them the day before about this appointment, you just made these plans, which is our reality. So, like in this example, the feelings aren't always objectively right. It's important to remember that they might be feeling a bit out of control about what's going on in their world. So rather than launching into that explanation, you just spoke to them the day before to arrange the ride, trying your best to meet them in their reality. And in doing so, it might help to accept the blame, even when you've done nothing wrong. So, thinking about, a helpful response can sound something like, "Oh, I'm so sorry. I see that I caught you off guard. I must have forgotten to call you and remind you about this appointment. But don't worry, we've got plenty of time. Maybe can I help you find your coat?" In a nutshell, avoid arguing over the facts. It's often a lose lose situation. Both parties are going to be frustrated, and neither is going to be right in the end because that argument is taking place in two separate realities. So, really, a better strategy is to join the person in their reality as much as possible. And we often have a saying, connect, don't correct. And this is helpful to remind ourselves that it's often more productive and more positive to put the priority on connecting with the person rather than making sure all of those facts are correct. Now, I do want to take a pause here and acknowledge that, this isn't always easy. And it can be really hard to always take the blame for things. And especially if, something that's coming up sparks an emotional trigger for yourself as well. So, really coming back to the importance of that pause and allowing yourself to acknowledge the emotions that are coming up for you as well in these moments. These strategies, and I know I went through them quite quickly, are absolutely easier said than done. So it really is important to remember to be gracious and patient with yourself because it does take practice. These are not how we would typically respond in these moments or our natural ways of communicating with one another. So it can take, some trial and error to find a response that works for the both of you. And know too that we're also here to support you. So if this is something that you're experiencing and would like to go over this strategy in a way that's more specific to your situation, you can always give us a call on the First Link Dementia Helpline, and we can help you to work through these strategies. Knowing too, though, the signs and symptoms, as we went through earlier, these can fluctuate from day to day or even throughout the day as well. So if communication is really starting to is a challenge in those moments, it can be an indicator that maybe it's just not the best time to be having that conversation with the person. So if communication is breaking down, it might also be helpful just to save that conversation, especially if it's an important one, for a later time as well. Okay. So just as we wrap up, know that adjusting to changes in communication as dementia progresses is difficult both for the person living with dementia and those that are in the community, whether it be neighbors, friends, family members. But there are things that you can do to help cope. So, as much as possible, trying to stay positive and patient. Practicing good self care can help you to succeed in this more often. We often hear from care partners that they lose patience more when they're tired. So, getting rest, taking breaks, and accepting help are all ways that care partners can maintain their strength. Using humor when appropriate. We often hear from care partners, if you don't laugh, you'll be crying all the time. Laughing can certainly help care partners and people living with dementia through some very difficult times. And humor can bring some light to some frustrating situations. However, it is, cautious. There may be situations where the person living with dementia is feeling angry or frustrated, and humor may not be understood or well received in these moments. So, just a bit of caution in using humor too, as there might be some nonverbal signs that it may not be the most appropriate strategy. And lastly, trying not to take things personally. I know this is so much easier said than done, but try and remember that it is the disease that's causing the symptoms. The person with dementia is not doing or saying things on purpose. And most often is feeling frustrated at themselves or the situation. So being patient and calm are ways to encourage them to keep attempting to communicate with you. Okay. So as we come to an end, I do want to open the floor for questions or comments. I'll take a look at the chat box to see if I missed anything. Just as we're maybe waiting for some questions to be coming up, just a reminder to complete the last half of the survey as well, part two, and the link is in there as well, I believe, in the chat and the QR code. Questions? Oh, thank you. So if you do want to keep connected with us, of course, we do offer lots of resources and support for those who are affected by dementia. We offer proactive support calls over the phone. From the dementia helpline as well. We have support groups both for care partners and those who are living within the early stages of dementia, as well as a program called Minds in Motion for people living with dementia and support to stay physically and socially active, as well as lots of other education workshops similar to this on various different topics as well. So, absolutely encouraged to connect with us or check out our website too. Just keep the first link to it. Oh, and our walk is coming up at the end of the month as well. So that is on Sunday. So I'm gonna just put a little short plug in that for there. But I'll leave the dementia helpline up to be able to connect.
Thank you so much, Lindsay. I guess we can just give everyone a couple more minutes just in case anybody did want to put in any questions in the chat. That was a very informative presentation. I feel like I've learned a lot. I didn't know that you could have more than one type of dementia at once. So you always can learn something new. We will be sharing the recording out for folks if you want to re-watch it, and also a copy of the slides as well. And we can include the information about the First Link helpline as well as that upcoming Alzheimer's walk if people are interested in that. Yeah, so we'll just give a moment in case there's any other questions, but otherwise, unless there's anything else that you want to share, I think we could wrap up.
Absolutely. I did just see a question. The best way to reach out is through the helpline. Absolutely, yes. So that is going to be the most immediate response from us is to connect with us on the helpline, and the number is on the screen.
Yeah, well, if there aren't any further questions then, I think everyone really enjoyed the presentation. So thank you so much for your time today. We really appreciate it. And thank you everyone for joining the webinar, and we hope that you found it informative. And please feel free to reach out if you have any other questions, or check out the website or helpline. So
Thanks so much,
thank you,
Laura.
everyone.
Thanks for having me.